Coronary artery disease, CAD, remains one of the leading causes of death worldwide. For decades, cardiologists and researchers have been grappling with the question of whether coronary atherosclerosis, the buildup of fatty deposits in the arteries, can be reversed. And even more critically, can coronary calcium scores, which measure the level of calcium deposits in the arteries, provide an accurate prediction of future heart risks or offer hope for a possible cure? These questions have sparked extensive research and debate among cardiologists and medical professionals. The link between lifestyle choices and heart disease has been a focal point in cardiology for years. But as much as we've come to understand about the factors that influence coronary atherosclerosis, there remains a cloud of uncertainty surrounding the extent to which we can reverse or halt its progression. At the heart of this is the coronary calcium score, a key diagnostic tool that many doctors rely on to evaluate the risk of heart disease. However, this simple number doesn't provide all the answers, and what's more challenging is the fact that it may not offer much hope for those seeking to reverse the damage already done. The question that arises, then, is whether lifestyle changes can make a meaningful impact in this battle. Specifically, can aggressive lifestyle interventions, including diet, exercise, and other changes, halt or even reverse coronary artery disease, including the calcium buildup in the arteries? To answer that, we must dive into some of the most influential studies on the topic, including the work of pioneering cardiologist Dr. Dean Ornish. Dr. Ornish's groundbreaking research from the early 1990s, particularly his lifestyle heart trial, shed light on the potential for lifestyle changes to not just slow down the progression of coronary atherosclerosis, but in some cases, reverse it. Dr. Ornish's trial focused on a combination of a very low-fat, vegetarian diet, exercise, stress reduction, and smoking cessation. The results were nothing short of transformative, demonstrating that patients with coronary artery disease who adhered to these lifestyle changes showed measurable improvements in their arterial health. This wasn't just about halting disease progression, it was about reversing it. In fact, Dr. Ornish's results were so compelling that he took his research all the way to Capitol Hill, arguing for Medicare coverage of his program. His success in getting approval for this coverage highlighted just how impactful his findings were, not only in the scientific community, but also in healthcare policy. Ornish's work demonstrated that coronary artery disease, often seen as irreversible, could be slowed or partially reversed with a disciplined approach to lifestyle changes. But, of course, Dr. Ornish wasn't alone in his efforts. Other prominent cardiologists, such as Dr. Caldwell Esselstyn from the Cleveland Clinic, have continued this line of research, showing similar results with a strict whole food, plant-based diet. His long-term studies have demonstrated not just a halting of coronary disease progression, but also a reduction in symptoms like angina, showing that lifestyle changes can offer tangible relief for patients. Despite these successes, the question remains, can coronary calcium scores be reversed? The answer is, unfortunately, less optimistic. Research has shown that while lifestyle changes can indeed slow the progression of coronary artery disease and improve the overall stability of plaque, they do not typically reduce the calcium score itself. The calcium score, which is a direct measure of calcium buildup in the arteries, tends to increase with time, even among individuals who make significant lifestyle changes. One of the biggest reasons for this lies in the nature of calcium itself. Calcium is a stable substance that, once deposited in the arteries, doesn't easily dissolve. The progression of calcium buildup, while it can be slowed, rarely reverses. In fact, the calcium score often increases slightly, even in patients who are actively managing their cholesterol with medications like statins. This phenomenon, known as the statin paradox, suggests that while statins are effective in making plaque more stable and less likely to rupture, they do not significantly reduce the calcium deposits within the arteries. The medical consensus on calcium scores today is that they are largely irreversible markers of past damage. These scores serve as a kind of historical record of the damage done to the coronary arteries over time. They are not necessarily predictive of future heart attacks or strokes, but they do provide valuable insight into the overall condition of a patient's cardiovascular health. In fact, the role of calcium scoring is shifting from being seen as a target for treatment to a tool for assessing overall risk. What's even more important than lowering the calcium score, however, is the stability of the plaque in the arteries. The goal of treatment and lifestyle interventions is not necessarily to shrink or eliminate plaque, but to make it more stable. Stable plaque is less likely to rupture and cause blood clots, which are the primary triggers for heart attacks. This concept, plaque stability, is emerging as a more reliable marker for long-term heart health than the reduction of the calcium score. Emerging research suggests that lifestyle changes, such as adopting a Mediterranean-style diet, losing weight, and engaging in regular aerobic exercise, help improve the composition of the plaques. These changes lead to plaques becoming more fibrous and rigid, which decreases their vulnerability to rupture. The more stable the plaque, the less likely it is to cause serious blockages that lead to heart attacks. This focus on plaque composition, rather than the size or number of plaques, may represent the future of cardiovascular disease treatment and prevention. Dr. Ornish and other researchers, like Dr. Pritikin, have demonstrated that aggressive lifestyle modifications, in combination with medications like statins, can lead to the regression of soft plaques, the most dangerous type of plaque that is prone to rupture. Clinical trials and imaging studies have shown that LDL-lowering treatments and lifestyle interventions can help stabilize soft plaques, making them less likely to cause serious harm. But despite these advances, the reduction of coronary calcium scores remains an elusive goal. Most of the available data points to stabilization or slow progression of calcium deposits, rather than a significant reduction. According to guidelines from major cardiology organizations, including the American Heart Association and the European Society of Cardiology, calcium scores should be viewed primarily as a risk marker, not a treatment target. This brings us back to the question of whether coronary atherosclerosis can truly be reversed. The reality, based on current research and clinical consensus, is that coronary artery disease can be partially reversed or stabilized with aggressive lifestyle changes and medications. However, coronary calcium scores rarely go down, and even with the best efforts, the progression of calcium buildup is difficult to halt completely. What is important, however, is the slowing of the disease's progression and the reduction in the plaque vulnerability. These measures, while not glamorous, are the true markers of success in cardiovascular care. To fully understand the challenges in reversing coronary artery disease, CAD, it's essential to grasp the underlying mechanisms of coronary atherosclerosis and the role of calcium scoring. Coronary atherosclerosis is a progressive condition in which plaque builds up inside the arteries that supply the heart with blood. Over time, these plaques, made of fat, cholesterol, calcium, and other substances, can narrow the arteries, restricting blood flow and increasing the risk of a heart attack. The key to understanding why reversing coronary artery disease is so difficult lies in the composition of these plaques. Initially, plaques are soft and unstable, containing large amounts of cholesterol and fat. When these soft plaques rupture, they release their contents into the bloodstream, causing the formation of blood clots that can obstruct blood flow, leading to a heart attack. However, over time, these plaques become more stable as they become harder and more fibrous, a process known as plaque calcification. This is where coronary calcium scoring comes into play. Calcium scoring is a non-invasive imaging technique that uses a CT scan to detect and quantify calcium deposits in the coronary arteries. The calcium score is often used as an indicator of the severity of coronary atherosclerosis. A higher score suggests a greater burden of calcified plaque, which is associated with an increased risk of heart attack and other cardiovascular events. However, while calcium scoring can be helpful in predicting future risks, it cannot reverse the damage that has already been done. Once calcium deposits are present in the arteries, they are permanent. The score may increase with time as more calcium is deposited, but it is unlikely to decrease significantly through lifestyle changes or medication. The reason for this lies in the nature of calcium itself. Calcium is a mineral that is deposited in the arteries as part of the body's natural healing response to injury. When the arterial walls are damaged by factors such as high blood pressure, high cholesterol, or smoking, calcium is deposited to repair the damage. Unfortunately, this repair process leads to the thickening and stiffening of the arterial walls, which impedes blood flow. While the body's efforts to repair damaged arteries are important, the resulting calcium buildup can actually worsen the problem, leading to more severe narrowing of the arteries and an increased risk of heart disease. While it may seem discouraging that calcium deposits cannot be reversed, the silver lining is that the progression of atherosclerosis can be slowed, and the plaques can become more stable, reducing the risk of dangerous complications like heart attacks and strokes. The ultimate goal of treatment, therefore, is not to erase the calcium deposits, but to stabilize the plaques and prevent them from rupturing. The stabilizing effect of medications like statins plays a critical role in this process. Statins are a class of drugs commonly used to lower cholesterol levels, and they have been shown to reduce the inflammation within plaques, making them less likely to rupture. Statins also improve the overall function of the endothelial cells that line the arteries, which helps prevent further damage and promotes the healing process. While statins do not lower the calcium score directly, they help make the plaques more stable, which is a crucial factor in preventing heart attacks. In addition to statins, new medications like PCSK9 inhibitors have shown promise in reducing the risk of cardiovascular events by further lowering cholesterol levels. These drugs are typically used for patients who do not respond well to statins or who are at high risk for heart disease. PCSK9 inhibitors work by blocking a protein that interferes with the liver's ability to clear LDL cholesterol from the bloodstream. As a result, these medications can dramatically reduce the amount of bad cholesterol in the blood, which helps prevent further plaque buildup and stabilizes existing plaques. However, while medications are important tools in the fight against coronary artery disease, they are not a substitute for lifestyle changes. Research has shown that diet, exercise, and other lifestyle modifications can have a profound impact on cardiovascular health. The Mediterranean diet, for example, which emphasizes fruits, vegetables, whole grains, lean proteins, and healthy fats, has been shown to reduce the risk of heart disease and stabilize plaque in the arteries. Weight loss and smoking cessation are also critical components of any heart-healthy lifestyle. Exercise, particularly aerobic activity, has been shown to improve endothelial function, reduce inflammation, and lower cholesterol levels, all of which contribute to improved cardiovascular health. Regular exercise also helps manage other risk factors for heart disease, such as high blood pressure and obesity. Even modest increases in physical activity can have a significant impact on heart health. In addition to improving cardiovascular health, lifestyle changes can also enhance the effectiveness of medications. For example, studies have shown that patients who make dietary changes and exercise regularly experience greater reductions in cholesterol levels when taking statins. This synergistic effect between lifestyle changes and medication highlights the importance of adopting a comprehensive approach to managing coronary artery disease. While medications and lifestyle changes can slow the progression of coronary artery disease and stabilize plaques, they do not typically reduce the calcium score itself. This remains a significant challenge for patients and healthcare providers alike. However, the focus on plaque stability, rather than calcium reduction, marks a shift in the way we view cardiovascular disease management. By prioritizing the prevention of plaque rupture and the reduction of heart attack risk, doctors are able to offer patients more effective strategies for managing their condition. Moreover, the clinical community has begun to shift its perspective on calcium scores. While calcium scores are still valuable in assessing risk, they are now seen as a marker of past damage rather than a target for treatment. This shift in perspective has important implications for patient care, as it encourages a focus on prevention rather than trying to reverse the damage that has already been done. As we delve deeper into coronary artery disease, CAD, and coronary atherosclerosis, it's critical to shift our focus from simply reducing calcium scores to a more nuanced understanding of the disease: plaque stability. While the reduction of coronary calcium scores has been deemed nearly impossible, stabilizing the plaque in the arteries is not only achievable, but it's the most effective strategy for preventing heart attacks and strokes. This shift in focus represents a significant advancement in how cardiologists approach heart disease management, and it underscores the importance of comprehensive care that includes both lifestyle interventions and pharmaceutical treatments. At the core of coronary atherosclerosis is the presence of plaque, a mixture of cholesterol, fatty substances, cellular debris, and calcium. Initially, these plaques are soft and vulnerable to rupture. When these soft plaques rupture, the body responds by forming blood clots to seal the rupture, which can block blood flow, potentially leading to a heart attack. However, as plaques mature, they become more fibrous and calcified, which makes them less likely to rupture. The goal of treatment is to enhance this natural process of plaque stabilization, making it more rigid and less likely to lead to a catastrophic cardiovascular event. Medications like statins play an essential role in this stabilization process. Statins, by lowering LDL cholesterol, often referred to as bad cholesterol, help reduce the fatty components of plaque. This reduction in lipid content results in plaques becoming more fibrous and stiff, thus preventing them from rupturing. Studies have shown that patients who take statins not only see improvements in cholesterol levels, but also experience a reduction in the overall inflammation of plaque, further increasing its stability. In addition to statins, there are other medications, such as PCSK9 inhibitors, which have gained attention in recent years. These inhibitors work by lowering LDL cholesterol to unprecedented levels, which further enhances plaque stability. although they are typically prescribed to patients who have not responded to statins or those who are at high risk for heart disease. PCSK9 inhibitors have demonstrated their ability to improve plaque composition and reduce the overall risk of cardiovascular events. However, while these medications are pivotal in stabilizing plaques, they are most effective when combined with lifestyle changes. A heart-healthy lifestyle, including regular physical activity, a balanced diet, smoking cessation, and weight management, can enhance the benefits of medications and help maintain plaque stability. For instance, exercise has been shown to reduce blood pressure, lower cholesterol levels, and improve the health of the endothelial cells that line the arteries. This leads to healthier, more stable plaques and a reduced risk of heart attacks or strokes. Diet plays an equally important role in maintaining plaque stability. The Mediterranean diet, which is rich in fruits, vegetables, whole grains, and healthy fats like olive oil, has been shown to improve cardiovascular health. This diet not only lowers cholesterol, but also reduces inflammation, making plaques less likely to rupture. The whole food, plant-based diet promoted by Dr. Caldwell Esselstyn has also shown promising results in halting the progression of coronary artery disease and improving symptoms like angina. Smoking cessation is another vital component of plaque stability. Smoking accelerates the development of coronary artery disease by promoting inflammation, increasing plaque formation, and damaging the endothelium. Quitting smoking reduces these harmful effects and contributes to the overall stability of plaque, lowering the risk of sudden cardiovascular events. While plaque stabilization is a key focus of treatment, it's also essential to manage other risk factors for heart disease. High blood pressure, diabetes, and obesity are all major contributors to the development and progression of atherosclerosis. By controlling these risk factors, patients can further reduce their chances of suffering from a heart attack or stroke. Blood pressure control, for instance, helps reduce the strain on the arteries, which prevents further damage and reduces the likelihood of plaque rupture. In the clinical world, it's understood that coronary artery disease is a long-term condition. It may never fully go away, but it can be managed effectively with the right combination of medication, lifestyle changes, and careful monitoring. The ultimate goal is not necessarily to reverse the disease, but to prevent it from progressing to the point where it becomes life-threatening. By stabilizing the plaques and reducing the risk of rupture, doctors are able to help patients live longer, healthier lives, even with coronary atherosclerosis. As research continues to evolve, more advanced treatments and strategies will emerge. Some of the latest studies have focused on the potential for regenerative medicine, such as stem cell therapies, to repair damaged arteries and promote the growth of healthy tissue. While these treatments are still in their infancy, they hold promise for the future of cardiovascular disease management. However, for the time being, lifestyle changes remain the cornerstone of heart disease prevention. It's clear that an integrated approach, combining medical treatments with healthier habits, is the most effective way to manage coronary artery disease. This approach is not just about reducing the calcium score or eliminating plaque, but about making the heart healthier and more resilient in the long term. The growing body of evidence shows that aggressive lifestyle changes, along with appropriate medications, can have a profound impact on cardiovascular health. They can prevent the further progression of coronary artery disease, stabilize plaques, and reduce the risk of heart attacks and strokes. The heart may not be fully healed, but it can be made more resilient, and that resilience is the true victory in the fight against heart disease. The importance of lifestyle modifications in the prevention and management of coronary artery disease, CAD, cannot be overstated. For years, the focus in cardiology has been primarily on medications and surgical interventions as the primary tools for treating heart disease. However, emerging evidence has demonstrated that lifestyle changes, including dietary adjustments, physical activity, and smoking cessation, can significantly enhance cardiovascular health. While coronary calcium scores may not decrease dramatically, lifestyle interventions offer the potential to slow the progression of the disease and reduce the risk of heart attacks and strokes. One of the most profound findings from decades of cardiovascular research is the power of a healthy diet. Diet plays an essential role in shaping the risk factors that contribute to coronary artery disease, including high cholesterol, high blood pressure, and obesity. The Mediterranean diet, often touted as one of the healthiest eating patterns, emphasizes the consumption of plant-based foods, healthy fats, and lean proteins, all of which have been shown to reduce inflammation and stabilize plaques. The focus on healthy fats, such as those found in olive oil and nuts, helps to lower levels of LDL cholesterol, while antioxidants found in fruits and vegetables help combat oxidative stress, a significant factor in the development of atherosclerosis. Dr. Ornish's research also highlighted the role of a very low-fat, plant-based diet in reversing coronary artery disease. His lifestyle heart trial demonstrated that patients who adhered to a diet that eliminated most animal products and was rich in fruits, vegetables, and whole grains saw improvements in their cholesterol levels, blood pressure, and overall heart health. Notably, this diet also helped improve the stability of coronary plaques, reducing the risk of plaque rupture and heart attack. In addition to dietary changes, regular physical activity is one of the most effective ways to prevent and manage heart disease. Exercise improves cardiovascular health by strengthening the heart, lowering blood pressure, and enhancing the health of the endothelium, the inner lining of blood vessels. The benefits of exercise extend beyond just physical fitness. It also reduces stress and promotes mental well-being, both of which are critical factors in heart health. Research has shown that regular aerobic exercise can reduce the risk of heart disease by improving cholesterol levels, increasing blood flow, and stabilizing arterial plaques. For patients with coronary artery disease, incorporating exercise into their daily routine can significantly improve their prognosis. In fact, even modest increases in physical activity can have a profound impact on heart health. The American Heart Association recommends at least 150 minutes of moderate intensity exercise, or 75 minutes of vigorous intensity exercise each week, along with muscle strengthening activities at least twice a week. These recommendations align with the growing body of evidence that suggests physical activity is a key component of any heart disease prevention strategy. In addition to diet and exercise, smoking cessation is one of the most critical lifestyle changes that can improve cardiovascular health. Smoking is a major contributor to the development of atherosclerosis, as it accelerates plaque formation, increases inflammation, and damages the endothelial cells that line the arteries. Quitting smoking can have a rapid and significant impact on heart health, reducing the risk of further damage to the arteries and improving the overall stability of plaques. Studies have shown that patients who quit smoking experience improvements in blood pressure, cholesterol levels, and endothelial function, all of which contribute to a reduced risk of cardiovascular events. While lifestyle changes play an undeniable role in the prevention and management of heart disease, it is important to recognize that they are most effective when combined with appropriate medical treatment. Statins, for example, can help lower LDL cholesterol levels and stabilize plaque, but they work best when patients also adopt heart-healthy habits. Similarly, medications like PCSK9 inhibitors can provide additional protection for patients at high risk, but they do not replace the need for lifestyle interventions. The synergy between lifestyle changes and medications has been a key focus of recent research, with studies showing that patients who make lifestyle modifications while taking medications experience better outcomes than those who rely on medications alone. For example, a study published in the Journal of the American College of Cardiology found that patients with coronary artery disease who adhered to a Mediterranean diet, exercised regularly, and took statins experienced a greater reduction in cardiovascular events compared to those who relied solely on medication. However, the question remains, how do we encourage more patients to make these lifestyle changes? The challenge lies in breaking the cycle of unhealthy habits that have become ingrained in modern society. Despite widespread awareness of the risks of smoking, poor diet, and lack of exercise, many individuals continue to engage in behaviors that contribute to heart disease. Public health campaigns, healthcare policies, and patient education are critical components of any strategy to reduce the burden of cardiovascular disease. Healthcare providers play a vital role in promoting lifestyle changes. Cardiologists and primary care physicians can help patients understand the importance of adopting heart-healthy habits and provide the support and resources necessary to make lasting changes. This includes offering nutritional counseling, recommending exercise programs, and providing smoking cessation support. Furthermore, healthcare systems can implement policies that promote access to healthy food options, physical activity programs, and smoking cessation resources, ensuring that patients have the tools they need to improve their heart health. One of the biggest obstacles to implementing lifestyle changes on a large scale is the societal environment. In many parts of the world, access to healthy foods, safe spaces for exercise, and healthcare resources is limited. Addressing these systemic barriers is essential to improving public health and reducing the prevalence of heart disease. Governments and policymakers must prioritize initiatives that make healthy living accessible to everyone, regardless of socioeconomic status. In addition to individual efforts, societal-level interventions are needed to create environments that support heart-healthy behaviors. This includes urban planning that encourages physical activity, promoting access to nutritious foods, and reducing exposure to harmful substances like tobacco. Public health campaigns aimed at educating individuals about the risks of poor lifestyle choices and the benefits of heart-healthy habits can also play a crucial role in preventing heart disease. The global rise in cardiovascular disease is a pressing issue, but there is hope. With the right combination of lifestyle changes, medical treatments, and public health interventions, it is possible to slow the progression of coronary artery disease, stabilize plaques, and reduce the risk of heart attacks and strokes. While the calcium score may remain a permanent marker of past damage, it is the focus on plaque, stability, and event prevention that offers the most promise for the future of heart disease management. As we look to the future of cardiovascular disease, CVD, management, the landscape is evolving rapidly, thanks to ongoing research and advancements in medical technology. Although lifestyle changes and medications remain the cornerstone of treatment for coronary artery disease, CAD, innovative therapies and novel strategies are being explored that could potentially change the way we approach the disease. Understanding these advancements and their implications for patient care is crucial as we strive for better outcomes in the battle against heart disease. One area that has generated considerable interest in recent years is the role of genetic factors in the development of coronary artery disease. It has long been known that family history plays a significant role in an individual's risk of developing heart disease. However, recent breakthroughs in genetic research are shedding light on how specific genes contribute to the development of atherosclerosis. The identification of genetic risk factors for CAD could lead to more personalized treatment plans, where individuals at higher genetic risk could benefit from early interventions, including medication, lifestyle modifications, and more intensive monitoring. Additionally, advancements in genomic medicine could allow for the development of targeted therapies that specifically address the genetic underpinnings of cardiovascular disease. For instance, CRISPR gene editing. Technology has the potential to correct genetic mutations that contribute to high cholesterol levels or other conditions that predispose individuals to CAD. While still in its infancy, gene therapy is an exciting area of research that could one day allow for the precise manipulation of genes involved in cardiovascular health, offering a more individualized and effective treatment approach. Another promising area of research lies in the field of regenerative medicine. While medications like statins and PCSK9 inhibitors are effective in stabilizing plaques and slowing the progression of heart disease, they do not address the root cause of the damage. Regenerative medicine aims to repair or regenerate damaged tissues, and in the case of CAD, this could mean the repair of damaged arteries or the regeneration of healthy endothelial cells. Stem cell therapy, for example, is being studied for its potential to repair damaged heart tissue and even reverse some of the damage caused by heart attacks. While still largely experimental, regenerative medicine holds the promise of not just managing CAD, but potentially repairing some of the damage that has already been done. In addition to these cutting-edge technologies, artificial intelligence, AI, is becoming an increasingly valuable tool in cardiovascular disease management. AI can assist in diagnosing CAD earlier and more accurately by analyzing medical imaging and genetic data. AI algorithms are being developed to predict a patient's risk of heart disease based on factors like calcium scoring, cholesterol levels, and family history, allowing for earlier intervention and more personalized care plans. Furthermore, AI can help doctors monitor patients more efficiently, analyzing trends in patient data over time and alerting healthcare providers to any concerning developments. On the treatment side, there is growing interest in the potential of novel drug therapies that target the underlying mechanisms of heart disease. One such drug class is LDL apheresis, which is a treatment designed to remove excess LDL cholesterol from the blood. This procedure has shown promise for patients with familial hypercholesterolemia, a genetic disorder that leads to extremely high cholesterol levels and an increased risk of CAD. As the understanding of cardiovascular disease continues to deepen, it is likely that we will see more treatments tailored to specific subgroups of patients, making heart disease management more effective than ever before. Furthermore, vascular biology has become an increasingly important focus in cardiovascular research. Studies have revealed the significant role that endothelial cells, which line the inside of blood vessels, play in the development of atherosclerosis. Researchers are exploring ways to repair damaged endothelial cells, potentially reversing the progression of CAD. Therapies aimed at promoting endothelial cell regeneration or preventing endothelial dysfunction could significantly reduce the risk of heart disease and other vascular conditions. The advancement of medical imaging technologies also plays a vital role in improving heart disease detection and treatment. New imaging techniques, such as ME, magnetic resonance imaging, MRI, and optical coherence tomography, OCT, are being used to assess the condition of coronary arteries in real time. These technologies offer detailed insights into the size, composition, and stability of plaques, allowing doctors to better understand the progression of atherosclerosis and tailor treatment plans accordingly. In the near future, these imaging methods could become more widely available, offering patients and healthcare providers the ability to closely monitor and manage heart disease more effectively. While these technological and therapeutic advancements hold great promise, the foundation of effective cardiovascular disease management will always be built on the principles of prevention. Lifestyle changes, including a healthy diet, regular exercise, smoking cessation, and stress management, will remain the most powerful tools in preventing heart disease. The combination of these changes with the growing array of medical treatments will help improve the quality of life for patients and reduce the overall burden of cardiovascular disease globally. Public health initiatives also play a crucial role in reducing the prevalence of heart disease. Governments and healthcare organizations must continue to invest in policies and programs that promote heart-healthy behaviors. This includes implementing community-based programs that encourage physical activity, promoting access to healthy foods, and reducing exposure to harmful substances like tobacco. In addition, improving public awareness of the importance of heart health can lead to earlier detection and intervention, ultimately saving lives. The integration of fewer healthcare systems and digital health technologies is another area that holds great promise for the future. Digital health tools, such as mobile apps and wearable devices, can help individuals monitor their health metrics, such as heart rate, blood pressure, and cholesterol levels, in real time. This empowers patients to take an active role in their heart health and allows doctors to monitor their progress more efficiently. The use of telemedicine, especially in rural or underserved areas, can further enhance access to cardiovascular care and improve patient outcomes. In conclusion, the future of cardiovascular disease management is bright, thanks to ongoing research, technological advancements, and a deeper understanding of the disease. While reversing coronary artery disease and calcium scores remains a significant challenge, there is hope in the form of new therapies, personalized treatments, and prevention strategies that can help patients live longer, healthier lives. As the field continues to evolve, we can expect to see more innovative solutions emerge, making heart disease more manageable and less deadly than ever before. As we move forward in the battle against coronary artery disease, CAD, and other cardiovascular conditions, it's important to recognize that the future of heart disease prevention and treatment will rely not just on advancements in technology and medications, but also on a fundamental shift toward patient-centered care. This approach focuses on the individual needs, preferences, and values of patients, empowering them to take an active role in managing their heart health. By combining cutting-edge medical interventions with personalized care strategies, we can offer more holistic solutions that improve both quality of life and long-term outcomes. A key aspect of patient-centered care is shared decision-making. In the past, medical decisions were often made primarily by healthcare providers, with patients following their instructions. However, as our understanding of heart disease and its treatment evolves, there is a growing recognition that patients should be integral to the decision-making process. By engaging patients in discussions about their treatment options, whether it's about medications, lifestyle changes, or advanced interventions like surgery or stem cell therapy, we empower them to take ownership of their health. This approach has been shown to improve patient satisfaction, adherence to treatment plans, and overall outcomes. Tailored treatment plans are another crucial element of patient-centered care. Each patient's experience with heart disease is unique, influenced by factors such as genetics, lifestyle, medical history, and socioeconomic status. As a result, the one-size-fits-all approach to heart disease management is becoming less common. Instead, healthcare providers are increasingly adopting personalized medicine, which involves using genetic testing, biomarkers, and advanced imaging techniques to develop customized treatment plans. This tailored approach ensures that patients receive the most effective treatments based on their individual needs. For example, patients with high genetic risk for heart disease may benefit from early and aggressive interventions, such as cholesterol-lowering medications or statins, to prevent the onset of atherosclerosis. On the other hand, patients who are more likely to develop CAD due to lifestyle factors, such as poor diet and lack of exercise, may benefit from a more intensive focus on lifestyle changes, including diet modifications and exercise programs. Personalized care also extends to the mental and emotional aspects of treatment, as mental health is closely linked to heart health. Addressing stress, anxiety, and depression, all of which are risk factors for heart disease, is a critical part of the treatment plan. Moreover, the integration of digital health technologies into patient-centered care is set to revolutionize how we monitor and manage heart disease. With the rise of wearable devices, mobile health apps, and remote monitoring systems, patients now have access to real-time data about their heart health. Devices like fitness trackers can monitor heart rate, activity levels, and even detect irregular heart rhythms, providing valuable insights into a patient's cardiovascular condition. These devices also help keep patients engaged in their care by providing immediate feedback on their progress, motivating them to stay on track with their lifestyle changes and medication adherence. Mobile health apps allow patients to track key metrics such as blood pressure, cholesterol levels, and weight, and they can share this information directly with their healthcare provider. This opens the door to more frequent and efficient communication between patients and doctors, reducing the need for in-person visits and allowing for quicker interventions when necessary. Remote monitoring also has the potential to improve access to care, particularly in rural or underserved areas, by reducing the need for patients to travel long distances to see a specialist. The use of telemedicine is another critical aspect of the evolving healthcare landscape. Telemedicine has become especially important in the wake of the COVID-19 pandemic, offering patients the ability to consult with healthcare providers remotely. For patients with chronic conditions like heart disease, telemedicine can provide continuous support, allowing doctors to monitor their progress and make adjustments to treatment plans without the need for frequent office visits. This is particularly beneficial for patients who are elderly, have mobility issues, or live in areas where healthcare access is limited. The continued development of artificial intelligence, AI, also has the potential to transform heart disease care in the coming years. AI algorithms are already being used to assist in diagnosing CAD by analyzing medical images, such as coronary CT scans and echocardiograms. These algorithms can detect subtle changes in the arteries that may be missed by human doctors, leading to earlier diagnosis and more precise treatment. AI is also being used to predict cardiovascular events by analyzing vast amounts of data, including genetic information, lifestyle factors, and clinical history. By identifying high-risk patients earlier, doctors can intervene sooner, potentially preventing heart attacks and strokes before they occur. Moreover, AI could also play a significant role in developing new drug therapies. By analyzing patterns in patient data, AI can help researchers identify new drug targets and accelerate the development of treatments tailored to the specific needs of heart disease patients. These innovations have the potential to significantly improve the effectiveness of cardiovascular treatments and enhance patient outcomes. Patient education is a cornerstone of patient-centered care. Educating patients about heart disease, its risk factors, and the importance of lifestyle changes empowers them to make informed decisions about their health. With more access to information through digital platforms, patients are increasingly taking charge of their own health, seeking out resources that allow them to better understand their condition and the steps they can take to manage it. Healthcare providers play an essential role in guiding patients through this process, offering support, answering questions, and helping them navigate the overwhelming amount of information available. Public health initiatives also play an essential role in the broader approach to heart disease prevention. Governments, healthcare organizations, and community-based programs are all working to promote heart-healthy lifestyles at a population level. These initiatives include campaigns to raise awareness about the dangers of smoking, the importance of healthy eating, and the need for regular exercise. Additionally, policymakers are working to improve access to healthcare, particularly in underserved communities, where heart disease rates are often higher due to socioeconomic factors. In conclusion, the future of heart disease prevention and management is bright. With ongoing research, technological innovations, and a shift toward patient-centered care, we are poised to make significant strides in reducing the impact of coronary artery disease. While lifestyle changes and medications remain the cornerstone of treatment, personalized care, digital health technologies, and advancements in artificial intelligence and regenerative medicine will continue to transform the landscape of heart disease management. As we move forward, a comprehensive, patient-centered approach to care will be essential to achieving better outcomes, improving quality of life, and ultimately reducing the global burden of heart disease.